1,200 residents a day in St. Louis County, and we have tested over 54,000 of our St. Louis County residents. Testing options continue to increase across the community. You can track the purchase of our testing supplies and our PPE at our transparency portal at stlcorona.com and follow along the St. Louis County Council Oversight Committee hearings at 10 a.m. every Tuesday. Starting Monday, we encourage anyone in St. Louis County who has frequent contact with those outside of your household to be tested for COVID-19. Even if you don't have any symptoms or you have had no contact with anyone who is known to be COVID-19 positive. You can obtain these tests at the John C. Murphy Clinic in Berkeley or in the South County Clinic in Sunset Hills starting Monday. These are at no cost to the patient. There remain several testing options in St. Louis County from other sources, and those may have different criteria for testing. They may vary from testing site to testing site. Early in the pandemic, the Department of Public Health was limited in their testing to symptomatic patients or those who had had a known response to a known contact with someone who was COVID-19 positive. Our ability to purchase more tests has allowed us to expect that if you're not worried about COVID-19, you should be tested to protect other people. The goal is to detect cases among those likely to transmit COVID-19 to others, those who may be in public-facing positions, such as working in nursing homes, hospital settings, grocery store workers, or delivery drivers, anyone with frequent contact with those outside of their household. Detection and identification of COVID-19 in people without symptoms is very important to prevent the spread in our community. So the Department of Public Health is offering free testing regardless of your ability to pay at either of our locations, and you may call 615-0574. That is 615-0574 for an appointment. We have the ability to test 150 patients per day and have the test results back in 48 hours. St. Louis County Department of Public Health also provides primary care, dental care, mental health services, substance abuse treatment services, and other programs. In addition to our central location, our location in Berkeley and our South County location in Sunset Hills will start seeing patients again on Monday. We will also be accepting new patients, so if you don't have a doctor, or if you've lost your health insurance or your access to medical care because of this pandemic, we encourage you to call and make an appointment. And that number is 615-0560, 615-0560 for an appointment in the St. Louis County Department of Public Health. We see over 35,000 patients every year in St. Louis County, and we are committed to taking care of our St. Louis County residents. We had planned in early March to update St. Louis County on the opioid epidemic and our response. But of course, our first case of COVID-19 was diagnosed in early March, and we had diverted our attention to this epidemic. But I don't want the important information and reports of what's happening with the opioid epidemic in our community to become unreported. We know that this opioid epidemic has had a devastating impact on our region and our country. And like COVID-19, it has a disproportionate impact on our African American community. Today we're releasing new statistics that will show a 13% decrease in opioid overdose deaths in 2019, down from 2018. In 2019, 266 people in St. Louis County died from an opioid overdose. In 2018, 307 St. Louis County residents died. 2019 was the first year since 2012 where opioid overdose deaths decreased in St. Louis County. 90% of the opioid overdose deaths in St. Louis County in 2019 were from fentanyl, a powerful synthetic opioid, much stronger than heroin. While the drop in overdose deaths in St. Louis County is good news, there is a disturbing trend. Deaths of black males in St. Louis County from opioids increased 47% in 2019. 47%. All other groups in St. Louis County, all other groups decreased in opioid deaths. This highlights a widening disparity in opioid-related deaths in our community and demonstrates a need for a targeted response. While it's too early to assess trends this year, we are concerned that social distancing may contribute to increased opioid deaths and abuse in our community. We know that some people will use opioids alone, and not having someone close by to rescue them from an overdose will increase the likelihood of death. We are engaged in a whole host of programs in the St. Louis County Department of Public Health to address racial disparities surrounding opioids. We have launched our Anyone Can campaign that highlights how opioids can affect everyone in St. Louis and tells a lot of individual true stories about opioids' impact on an individual and their family. Diverse community voices are highlighted, and we have concentrated this campaign in North St. Louis County. For more information, you can visit anyonecanstl.org. Narcan is also available in our St. Louis County clinics. We know that Narcan can reverse an opioid-related overdose. This medication is available for free at all of our St. Louis County Public Health Clinic locations, Monday through Friday. You can visit recoverstl.com, that is recoverstl.com, to learn how to access free Narcan from St. Louis County Department of Public Health. We remain committed to addressing the opioid crisis in St. Louis County as part of our public health emergency. As chairman of the St. Louis County Council in 2017, I sponsored and passed legislation to create the prescription drug monitoring program in St. Louis County. Since 2017, 74 other counties and jurisdictions in Missouri have subscribed to our program and participate in this prescription drug monitoring program, and this covers 84% of Missouri residents and 94% of our healthcare providers in Missouri. Missouri remains the only state in the country without a statewide prescription drug monitoring program. And I would be glad to answer any questions.
Going to the announcement of the two county clinics, so that basically means like starting Monday, the county will be testing asymptomatic people. Or are they already doing that right now?
So the county will start testing asymptomatic county residents on Monday with an appointment, but you have to call to get an appointment. We have in the past concentrated our testing on symptomatic patients and patients who have a known exposure to someone who has COVID-19. But as we have been able to purchase more tests, we are going to focus on a containment model and start testing people who do not have symptoms but may have a public-facing job, or others who just want to be tested.
I've heard some of my colleagues who have tried to get tested in the city where they're also basically offering a similar service, like the wait times are very long and it's very difficult to get through to the phone number you just mentioned. What precautions is the county taking to make sure that the appointment call centers don't get overloaded?
Well, we have recruited extra resources for our St. Louis County Public Health Clinics to man the phones to make sure that someone is there. But if someone doesn't pick up, we'll get back to you. If there is a delay in getting tests, we can test 150 patients a day at St. Louis County Clinics. If there is more volume than that, then we'll look for other resources or to try and refer people to other sources in the community who can provide a test.
There's expected to be a pretty large protest tonight in Florissant based off the video of the Florissant police detective hitting a man with a car. I know there's been protests over the last few nights, but it's expected to be a larger than one tonight. And I understand that this is a municipal police department and wasn't the county police department involved, but number one, is the county police going to be involved in any security measures tonight? And number two, have you seen the video in particular, and do you have any reaction to what's going on?
Well, certainly I've seen the video and it's disturbing, and we're all waiting to see the Florissant's Police Department's response in that investigation and the results of that investigation. I'm not surprised that there are people who are upset by that. And you know, this is a trend we're seeing across the country. More video is available, more of these interactions are documented, and I think it requires you know, a rapid response and an appropriate response by the Florissant Police Department. If St. Louis County is asked to help, we will. Generally, these protests have been peaceful. Even the protests that are at night are peaceful. What I've seen is that protesters are discouraging anyone who is not peaceful from any of that activity. And we've seen that across the country and here in our community, that these protests have been focused on their message and very targeted in their activities.
You have a question? Oh man, okay. So I think the last time I was here, I asked you about the $47 million that was going to be going to municipalities for public safety services. Obviously, in the last week, there's been kind of a national conversation about redirecting resources away from law enforcement and elsewhere. Is that something that you still are planning to do with the CARES Act money? Because I understand like the rhetorical aversion to doing that, but I also understand that a lot of municipalities are really hurting right now, and that could be seen as a relief valve during COVID-19. What's the status of that money?
Well, the $47 million that was requested from municipal police departments has been set aside while we try and find the proper process to manage the request and make sure that it can be done within the limits of federal law, because there are very strict guidelines on how that money can pass through to political subdivisions within a county. And those strict guidelines we're reviewing. We're going through that with our attorneys to make sure that we follow that, because if we don't follow those strict guidelines, then we would have to return that money to the federal government. And that means that it can't be used to supplant things that are already budgeted. It is directed towards expenses that were COVID-19 related. And that COVID-19 related expenses are subject to interpretation, and we're trying to make sure that that is clear. But we do want to try and help our municipal partners in the community if we can with some of their costs. At the same time, we expect to see not only a review of, and not only a professional response from our own police department, and I'm proud of the response that they've had during all of this over the past couple of weeks, but I still expect them to review their policies and take a deep dive into what's happening in the St. Louis County Police Department to make sure that the appropriate training is there and that training is available for everyone, and the appropriate response to these use of force questions are carried out within the county police department, and I would hope to see that in our municipal police departments as well. Questions?
No, I think